everyone. My name is Kimberly, and thank you so much for joining us today. We are here to have a very special conversation with a Miss Stacy Wood. She is a registered nurse at Sanderling Dialysis Clinic. Thank you so much for being here with us today.
My title is RN. I'm a registered nurse, and my name is Stacy Wood.
So, Ms. Wood, what is your role as a dialysis nurse?
That's a big question. My role as a dialysis nurse, we oversee treatment. We assist the patient pre, during, and post-treatment. We often advocate. I coordinate care between the doctor, the dietitian, the nurse. We help make appointments. There's a lot of education involved with diet and the dialysis treatment itself. We educate on work and travel and hopefully exercise. Depends on which state you're in. Some states allow nurses to do different levels of care. The state of Tennessee, for example, nurses only can do catheters. So we allow the techs to do fistulas and grafts. Nurses do catheters only. In other states, techs can do catheters. And so that allows the nurse to concentrate more on coordinating care for them in other ways.
So how does a dialysis nurse differ from a nurse in a hospital setting?
Well, I have done nursing in a hospital. Usually the level of acuity or sickness in the hospital is much higher. And so the patients are treated different. Often they're asleep. And getting to know the patient in a dialysis center, you see them 3 times a week, so you know their families and their histories and their stories about their grandchildren. You also see how compliant or non-compliant they are. You have to learn how to maintain professional boundaries in a chronic clinic because the lines are very different between a clinic and a hospital. I think in a clinic you suffer from caregiver fatigue more because of the non-compliance is so high. And I think a big difference also is, we as nurses are taught that HIPAA, confidentiality is a big deal, but all of our chairs are stuffed together and everybody knows everyone's story. There is almost no HIPAA in a dialysis clinic because it's really like a big family. The patients care about each other, they share stories. When the doctor's round, you're sitting next to the person that's also getting dialysis, so you hear what that person talks about with the doctor or the nurse or the tech, and so it's a lot of shared information. It's very different than a hospital where you're in a room all by yourself, very isolated. So the lines are different.
So what are some of the ways that you educate the kidney patients?
Well, we have to educate on diet. Even though we're not dietitians, we need to know a little bit about diet. We need to know how to refer the patient to the dietitian. Some of the questions that are often asked is, what is dialysis? What does dialysis do? And I often explain that it is an artificial kidney. It helps to show them the equipment and which part of the dialysis machine is the kidney. And the 2 main things with dialysis is removing toxins and removing fluid. That's the biggest part of the education. And compliance. I don't know how true this is. I've read there's an 85% non-compliance level in dialysis patients, and so it's a constant education on compliance and the negative effects of non-compliance.
So Ms. Ms. Wood, how long does a patient have to keep his or her catheter in, and how often is the catheter cleaned and why?
Ideally, they want catheters to stay in for as little time as possible. The risk for infection is very high, so ideally they want your fistula is your number one choice, your graft is your number two, and catheter is the least favorable choice due to high infection rate. The length of time that a catheter is in, there's a lot of factors. One is the health of your veins and arteries. Some people do not have strong veins and arteries, and they're unable to have a fistula or a graft. That's not true for most people. Some patients prefer the catheter because they don't want the fistula in their arm. They don't like the way it looks because it does get bigger, and you have some people's get really big, some are small. They stay small always, but most people's fistula grows. Some people don't like the thought of a graft in their arm because it's a hard object. It's like a garden hose that goes into your underneath your skin, and so they would prefer the catheter because of aesthetics, because of the way it looks. As far as cleaning the catheter, different facilities have different protocol. The general protocol is to clean and change the catheter dressing 3 times a week. In the hospital, depending on the style of dressing, it's once a week. So it just depends on where you're at and what the protocol is for that facility.
So how important is an exercise program for our dialysis patients?
Well, there's a myth in dialysis that patients are not supposed to exercise, or that they can't lift weights because of the fistulas in their arms and the grafts. And in general, that's not true. That it's actually, there's studies that show if dialysis patients exercise, they actually get cleaned better. It helps move the toxins out of their cells. It speeds up metabolism. Most people that do exercise on dialysis, they comment that it's the one thing that makes them feel normal again. And so I think that's very important it helps them feel a little bit of control in their life. Besides, it provides improved mental health for everybody, not just dialysis patients. That's mostly it, is that it's a myth that you can't exercise.
So Ms. Wood, is there any reason for a dialysis patient to be cautious of a regular exercise program?
Some dangers with exercising while you're a dialysis patient would be chest pain, pain in your arm, and your blood pressure. If your blood pressure is too high, if your resting blood pressure is too high, if your resting blood pressure is too low, and if your resting heart rate is too high. These are all issues that you should talk to your doctor about before you exercise.
So Ms. Wood, what happens to a dialysis patient who continuously misses his or her treatments?
Mistreatment is part of nursing education. It's a big part of it. People don't really know. They don't know if they can I miss one treatment a week if I don't want to go, and then I go the next time and I can add time to my machine or turn my goal up. None of those are good options. They're not healthy options. When you miss a treatment, you put yourself in danger of heart complications from increased potassium levels, increased fluid gain. When you gain a lot of fluid, you put a lot of stress on your heart. You also are at increased risk for stroke. It makes your next treatment very difficult. It increases cramping and hypotension, which is low blood pressure. When you miss a treatment, often it increases shortness of breath. You also increase your anemia. You decrease your bone health. missing one treatment is supposed to be the same as 4 months of treatment. So people don't realize how important it is to not miss a treatment. If you stop your treatment 15 minutes early, that's equal to 39 hours per year of missed treatment. You have to keep in mind that when your kidneys are normal and they work 24 hours a day, 7 days a week. And so when you're coming to dialysis, you only have a kidney that's working for 3 to 4 hours per day, 3 times a week. And so if you cut that treatment short, that's even less time that your kidneys are working. So compared to a normal person with normal kidneys that works 24 hours a day. The average lifespan of a dialysis patient is 5 years. That doesn't mean you're only going to live 5 years. That means that that's the average, and that's because non-compliance is so high. If you take care of yourself and you're compliant, often dialysis patients live 20, 30, 40 years. It's very possible. It's all depends on how you take care of yourself most of the time.
So what are the effects of too much fluid gain in between treatments?
Too much fluid gain has to do, again, with non-compliance, not adhering to diet, high salt intake, and too much drinking fluids of whatever kind. It increases, again, your cardiac risks with heart attack. It puts an incredible amount of pressure on your heart, increases your blood pressure. It causes hypertension. Increased shortness of breath. It makes your treatments more difficult. Increased fatigue. And pretty much your quality of life goes down with too much fluid gain between each treatment.
So Ms. Wood, there are patients that can still urinate. And if they can still urinate, can they occasionally miss treatments?
No, they're not. That's also a myth that if you pee, you don't have to come to treatment or you can drink more. They do have a little bit more leeway in how much they can drink because they do release the fluid. But kidney failure means that your kidneys are not cleaning. And so if your kidneys aren't cleaning, it doesn't matter how much you pee, you're still holding on to all the toxins, and you're still at increased risk for heart attack and stroke, increased anemia, decreased bone health.
So let's talk about a monthly report card and how important is it to getting a kidney transplant?
Compliance is, I am not a transplant specialist. When somebody expresses that they are interested in a transplant, I refer them to the transplant specialist, which is commonly the social worker.
The process for that is I always try to make them aware of all the transplant centers in the area, and based off of that, some would prefer a certain center, or they don't have a preference, so I would make that referral, and in making that referral is sending their medical records to that appropriate center, and from there they kind of make the contact, and after that I just follow up. So once they're referred, they'll be scheduled for an evaluation. So I'm always making the patient aware to understand the transplant process and to make sure that they're answering their phone and going to these appointments and what was said and what's the next steps. So usually they go for an evaluation, and then they start the workup phase, which is fulfilling certain obligations of that evaluation, and also working with insurance, just whatever I can do on my end to get them further along in the workup phase. And once they've gotten through the workup phase and they seem to be a very eligible candidate, that is when they're deemed active, and from there they are active on the list and could get called at any point.
Once they are on a transplant list or getting the workup for the transplant, we are responsible for drawing monthly labs. And yeah, it is important. If they're non-compliant and they don't follow the transplant guidelines and miss treatments, that decreases their chances of a transplant. So non-compliance is very detrimental to receiving a transplant.
Ms. Wood, what are some of the most important things you can do to maintain a healthy lifestyle while on dialysis?
Some of the most important things to maintain a healthy lifestyle is the same thing for everyone. It's to adhere to a dialysis, a renal diet, and exercise. And it's the same for everyone. It's just their diet is more strict. It's not an easy diet, and it is a harder lifestyle. But your outcomes are much more positive if you comply with the diet and come to treatment.
What are the most common mistakes you see that dialysis patients make?
I would say the number one mistake that dialysis patients make is non-compliance, is eating foods that are detrimental to their body and to their dialysis treatment, and missing treatment. Those are the two biggest problems. I also think a sedentary lifestyle is also a common issue with dialysis patients.
So Ms. Wood, why do some patients feel drained after a dialysis treatment? Are they still able to go to work? Can dialysis patients hold down a regular job?
Well, I think it's a complicated question. There's a lot of factors involved. Lifestyle and comorbidities are a big part of that. If I was talking to a new dialysis patient, I would want them to know that it's very common to be fatigued on dialysis. Most people are. I would also want them to know that most people are unable to work while they're on dialysis. Some are. That often has to do with what else is going on in their body, other diseases they may have, and how compliant they are with treatment. Age has a lot to do with it. So there's a lot of things that have to do with that. But in general, it is normal to be fatigued, and it's also very common that dialysis patients do not work.
Thank you so much, Ms. Wood, for being here with us today and giving us more insight on dialysis patients and the things that they go through. And to you, our viewers, thank you so much for being here with us today. Have a blessed day.